attendance.
Any birthday celebrants? Happy birthday, if there is.
Hey, Charmaine.
I have my doctor's note.
How are you doing, Charmaine?
Okay, just send it to me via Schoology, Miss Charmaine.
How are you?
Stop eating, John.
I don't
Okay.
know
Are you
how I
jealous?
am.
Miss Mubo,
You look 100 better today.
Present.
Miss Joyce Azul, Mr. B, yeah, present. Miss Charmaine is here. Mr. James.
Yes.
Okay,
Ma'am.
Miss Eslyn May. Eslyn May. Eslyn May.
I don't see her yet.
Okay. Miss Angelica.
I'm here.
Okay, thank you. And then Miss Guerrero Micaela.
Here.
Okay, thank you. And then Miss Evelyn Lopez.
Here.
Lopez. Okay, Mr. Emmanuel Okwong.
Here.
Okay, thank you. Mr. Alvaro Ortiz.
Here.
Okay, Miss Patel. 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 Okay, next, Mr. Jan.
I'm here.
Okay, Miss Reyes Erica. Miss Erica. Miss Erica. Okay, Miss Rubio Melissa. Miss Melissa, okay. Mr. J Santillan. Mr. J. Okay, next, Selby. Miss Selby.
I'm here, ma'am. I'm not washing dishes.
Okay, that's good. Congratulations, right? You're not washing dishes. Okay,
But
next.
doing laundry.
Okay, you're not doing laundry. Yadira, Miss Yadira.
I'm here.
Okay. For sure, Miss Yadira is not washing what? Dishes, right? Okay.
Dancing.
Okay, Rohel Velasco. Rohel. Mr. Rohel. And then Teresa. I saw her. Okay.
I'm here.
All right. Let's do it together. So again,
I'm here.
okay. So J, Erica. Okay. And then who is the Galaxy S2?
Sherry's here.
Okay,
That's,
Cherise.
Sherry's here.
Yeah, I know.
Oh,
Ate Eslena's here, Miss Mary Jane.
Who?
She's the Galaxy tab S2.
Who? Who?
Ate Esleen.
Oh, Eslyn. Okay, Eslyn. Okay, and then Jay. And then Erica. Erica. Yeah, I saw her. And then Patel. Miss Patel. Patel. Rohel. Okay. That's it. All right, let's move on. Okay, Miss Patel is here. If it is 3 minutes, 5 minutes, you know, that's fine with me. But not 1 hour. 30 minutes. I consider that is an absent. Okay, let's move on. Okay, so I will not hold you too long today because we covered a lot yesterday.
Yeah.
Okay, right? So I'm a little bit tired because we covered 200 plus slide yesterday. Okay, 200, almost 200.
Wow.
Almost. Okay.
Congrats.
So, congratulations, right?
Congratulations.
Okay, congratulations.
Yeah.
So, this is the one again. Your syllabus. This is your syllabus. Recall again. I covered 1, 2 yesterday, right?
Right.
And then today is the 3. Okay, the 3. Okay, now the coverage of your exam, write it down, the coverage of your exam will be on next week, August 3. Okay, August 3, next week. Okay, next week, August 3, 5 p.m. What are the coverage? The 1 to 3. Okay, we go over this one already. Day 1 to 3 is the coverage of your exam, 50 items. Now, if you listen to me, the question is very easy. If you listen to me. And then, after the slide number 4, this one, right? The slide number 4, which is the day 3. The day 3, right? The day 3, after that one, I'll go over from the beginning. So I need to finish this one, the day 3. And then I'll go over again, which is consider your review. Okay? I will not hold you too long because I can finish this one straightforward. So are we good?
Yes, Miss Mary Jane, the test you're gonna give it to us like last time through Schoology?
Yeah, to Schoology.
Okay.
Right? So like a modification. Why? Because the problem with multiple choice, you can send, don't get me wrong, you can send it to your classmate. 1, 2, 3, 4, 5, A, B, C, D. Okay? But for this one, I will see if you are copying each other. Because online is online. I mean, I cannot prevent anything in online. Okay? That's why I'm putting modification. Since you're doing ATI anyway, so that will be your practice. Next week, I will tell you what to do in your ATI.
Okay.
Okay? So this is the one. 1, 2, 3 are the coverage for exam number 1.
Okay.
Okay? All right. That's it. I don't want anybody to ask your classmate because I discussed it already. 1, 2, and 3. And then the coverage are the following. Okay? What type of question? 50 items, like a modification. Now, if you listen to me today or the other day, you will get a 50 over 50. If not, I don't know what to do. Okay? So that's it. So let's move on to slide number 4. Again, I will pinpoint again. Can you see my screen? The slide number 1, we're done. Slide number 2, we're done. Slide number 3, we're done. Okay, this is day 1 to 3. Now I'm entering with mental health number 4. Okay, which is slide number 4. Are you following me? We are a little bit advanced. So
Yeah.
congratulations. Okay, so we have a time. We have a time to what? We have a time to have a good review in ATI.
Yeah.
Okay, we have a time to have a good review in ATI. Okay, can you see my screen? Psychotic medication, chapter 15.
No.
No.
Oh, no? Okay,
No.
it's fine. That's fine. Hold on. Okay, can you see my screen?
Yes.
Chapter 15. Okay, make sure I don't want to repeat the information again. All right. For this chapter, this is 60 plus PowerPoint. Okay, if you are absent yesterday, I can go over, but not a thorough. Just like a review for psych. Okay, are you ready? I will not hold you too long for today because yesterday it was a long journey. Okay, welcome to chapter 15, psychotic medication or disorder. Okay, so this is a schizo. So remember the 3 column. Yesterday we go over with anxiety, right? Bipolar, and today the 3rd column are the psychotic disorder, which is the schizo. Okay, now, who is the schizo? Schizo, the etiology, pathophysiology, is increase of dopamine. Write it down. What is dopamine anyway? It's a neurotransmitter. Now, if the dopamine is up or down, it's all about for cognition and attitude. So, for example, your dopamine is down. That is what? That is Parkinson disease. Okay, what will happen? Confusion, amnesia. Okay, it's all about intelligence and behavior. How about if you have a what? If you have increase of what? Of dopamine. What will happen to you? Schizo.
Schizophrenic.
So what will happen? You are very intelligent.
Mhm.
But the what? The attitude is too much. Okay? It's very terrible. Why it's intelligent? Because of the dopamine. If you have a lack of dopamine, of course, not bipolar, the other one, the Parkinson disease. Okay, now, this is the thing. The schizo is what will not happen like an overnight. Sometimes there's an onset, late teens and early 20s. But it will not be a full-blown until you reach about 35 years old. Ah, okay. You have a signs and symptoms of schizo for early 20s, 25, okay, or early or late, but the full-blown will be on the late adulthood, such as 35 to 40 years old. Okay? So, okay, yeah. That's why we have to be careful in dealing this one. Schizo, probably, it can be a genetic. Because of what? Because of the dopamine. Or it can be a non-genetic. But I don't believe, for me, it's only a 10%. For me, it's a genetic. Right? So non-genetic, it can be injury at birth, viral infection, or nutritional factors. But when you say genetic, of course, the neurotransmitter is dopamine. Okay? So client has psychotic thinking. Now, don't memorize. What are the signs and symptoms of what? Of schizo. Okay? So, again, in general, how they think. They have a thought process problem. How they talk. Loss of association, clang association, word salad. And then how they what? They present themselves. Delusion of grandeur. Okay? So that's it. You don't need to memorize everything. But schizo is a psychotic disorder. Okay? So what are the different types of schizo? We have a different types. Paranoid. You know the paranoid, right? Delusion and hallucination, and they are thinking that everybody are bad, right? And everybody are trying to do harm, right? Catatonic. Catatonic, they are what? Sitting. The patient is sitting like that in a one position for 24 hours for a long time. Or when they what? We deal with catatonic before in the hospital. So I told them, okay, let's march. But when they march, right? So when they march, this one, the knee is up to here. They march to the highest level. Okay? So let's do. Raise our hand. Okay, let's do to the highest level. Catatonic. Okay, either way. Either they will stay for a long hours without moving, or either too much. Catatonic. Okay, are we good? Okay, next. Disorganized. You know the disorganized person. Everything is what? In life is disorganized. Everything. Right? Work, school, everything, relationship. Disorganized. Undifferentiated. Schizo symptom that don't neatly fit a diagnosis. Like what? Like there's a lot of what? Like undifferentiated, I consider like disorganized too. Like you are something. You have a lot of signs and symptoms, not only for schizo. And of course, residual. At least one episode of schizophrenia experienced in the past, but no longer exhibiting signs of disorder. Okay? But sometimes they will not ask too much about this one. Okay? Sometimes they will ask, of course, the signs and symptoms of what? Schizo. Okay? So next one. When you say schizo, this is psychotic. Right? When you say schizotypal personality disorder, so again, everything will be affected. I will not memorize this one. Unusual perception, meaning to say no insight. So they are what? Friendless except for family. Okay? And then they believe something differently. Okay? That's why delusion of grandeur. You know, that's why the schizo or a psych patient, you will be, oh, why they are talking? You know, it's very odd. Right? Very what? something. That's why sometimes you are what? This person is something like this, right? Because the way they talk, the way they think, and the way they present themselves is a little bit odd. Okay? So, doubt to other, paranoid. And of course, their appearance is something like a manic patient. And anxious and depressed is schizo. Okay? That is a schizo. Now, schizo, part of the schizo is the delusion of grandeur. So meaning to say, we are talking for schizo, right? Signs and symptoms of schizo, one of that, number one is delusional disorder. Okay, delusion of grandeur. Okay, so sometimes a month, sometimes it can take long. Again, I cannot do anything. We cannot do anything about schizo. This is a psych disorder. Medication, group therapy, diet, safety is our therapy for schizo. One of the signs and symptoms, as I told you, is what? Is the delusion of grandeur. Okay, of course, do they have anxiety? Check. Do they have a depression? Check.
Yes.
Yes, everything they have. Okay? Do they have like a very destructive attitude? Yes.
Yes.
Yes, yes, yes. All right? And then at the same time, they are thinking something. Okay? Their belief is a little bit odd. That's why when you talk to what? To undiagnosed schizo or psych patient, sometimes you are what? You are thinking, oh my God, this is something here. Okay? So clear? Yes or no?
Yes.
Okay, very good. Now, schizophreniform is another form, right? But sometimes they are not really into, they are not digging this one. You have to dig with schizo by itself. Okay, the question in the ATI is more on delusion of grandeur, word salad. What is word salad? They are talking different words, like a fruit salad. Loss of association, they are talking about the book. All of a sudden, they are talking about person, loss of association. Confabulation, they are making up a what? A story or a word. Okay, so that is a signs and symptoms of schizo. Okay, who is bipolar? Again, yesterday I told you bipolar is mood. Anxiety is GABA. Are you following me? When you say bipolar, it's a mood. That's why depression, serotonin is down. Manic, mania, overactive, hyperactive. Times 10 of what? ADHD. Schizo, this is a psych disorder. Okay, are you following me? Yes or no? Now, again, when you say schizoaffective, combination of bipolar and schizo. Usually, the schizo is a psychiatric disorder. Okay? I cannot say that anxiety is, is a psych unless here in America, if the elderly is telling that I'm depressed, they will what? The doctor will prescribe a what? Antidepressant right away. Okay? Are you following me? Yes or no? Okay, next, proceed. Aside from what? From its schizo. Okay? Another one, substance abuse induced psychotic disorder. Okay? So again, substance or a drug addict can be a psychotic. The answer is a big check. Okay? Why? The risk factor or the pathophysiology is because of what? Because of the intoxication. Because of the drug. Right? The drugs. Like the what? Like the marijuana. Right? It's not me. I know that marijuana is Mary Jane, right? Or what else aside from marijuana? Okay? When I was a child, they are calling me marijuana back home. Marijuana. Okay. So, marijuana. Okay? So, aside from marijuana is what else? Cocaine. Okay? The crack, right? So because of that too much, that's why what will happen to the brain? Substance intoxication and can lead to what? Psychosis. Okay, are you following me? That's why, when I was a medtech, right? I worked back home in the Philippines in the drug testing clinic laboratory. So we interview a lot of what? It's obvious, addict. Okay, the way they what? The way they talk to you is very odd. Okay? And then at the same time, I don't know. I know right away if what? If they are addict on their what? The way they talk. Okay? And then their appearance. Something like that. Now, when you say alcohol, that's another story. Okay? When I went to, I think, what's that? In Loreto and then in Methodist, we interview a lot of what? Of alcoholic and addict. Okay? The way they talk is something, my dear. Delusion of grandeur. They have a lot of plan. And you know that plan is what? It will not become what? A reality. Okay? They are what? They are drug addict or whatever, but they are thinking, oh, I will study at the UIC. I want to become engineer. Okay? And after next session, I will go back to that particular hospital. I will see them again. It's a never ending. Okay? Unless they will undergo a treatment or we call it rehab. Okay? Are we good? Yes or no?
Yeah.
So again, one of the what? Cause of psychotic disorder is what? Is the alcohol, but more on the substance abuse. Okay, are we good? Now let's go back to the catatonic. Aside from delusion of grandeur, the catatonic is one of the signs and symptoms of what? Of schizo. When they sit down here, they sit down for long hours without moving. Okay, and then when they what? When you ask, can you do marching to the highest level? Okay, so I'm very afraid because when they march, their knee is up to here. Okay, they do like that. Okay, so I told them, oh, sir, don't do that because you will hurt yourself. So let's do, like a little bit. Okay, so clear, catatonic. Catatonic. So again, schizo. Schizophrenia is what? The signs and symptoms, they can be a paranoid. Okay? Paranoid. Paranoid, one. Okay? And aside from paranoid, catatonic. Aside from catatonic, delusion of grandeur. Aside from delusion of grandeur, word salad. When they talk, word salad. Loss of association. Okay? No insight. And then confabulation. Okay? So that are the signs and symptoms of what? Of schizo. Okay? So I'm telling you, I outline for you. Okay, next one. Can you see my screen?
Yes.
Okay, what are the expected finding for psychotic medication? We have a positive symptoms. Hallucination, delusion, alteration in speech, bizarre behavior. Okay, so let's go to hallucination. What is hallucination?
Hallucination. See something that doesn't exist.
Okay, not only seeing, that's visual. How
Okay.
about the tactile?
Imagination.
Imagination. How about hearing?
Hearing.
Right?
Yeah.
They can
You
hear
thought you hear
something, right?
Okay.
Okay, that is hallucination, not only for one thing. Now, your question for hearing, right? So I almost what? I almost go out in the group therapy. In the group therapy, you are not allowed to smile, to use your cell phone. You have to, like that, remain or sit still because they will scold you to the highest level. Okay? So now we are in the group therapy. So the mental health worker asked one patient, okay, can you hear voices? And you know the what? The patient answer, very smart. Yes, I'm hearing your voice. Okay? So, me, I what? I almost walk out because I want to what? I want to laugh. Okay? So, pretty much I just go to, like on the side because, we are not allowed and I need to be model. Even I want to laugh, of course, I cannot what? I cannot laugh, right? I'll be in trouble. Yeah, I'm prone to what? I'm prone to complain. The manager is watching us. Yeah. So why you are laughing? It's not allowed. Okay. So we need to be
You
serious.
say, I think that was your hallucination.
Yeah.
You did not see that.
So just in case in what? In the test. So you have to ask, are you hearing voices that we cannot hear? Okay, that is the proper what? Proper question. Okay, we have a singer, right? Okay, who's that? All right, now, next one. What is delusion? Can you please
Okay, John.
define the delusion? Okay, delusion. Actually, I love psych. The psychiatric clinical gives me a what? I'm not lonely in the psych.
Fix crazy ideas.
Aside from that, it's not really that. You are what is delusion?
They have ideas about something that is impossible.
It's like false beliefs.
Or false ideas.
False
Yeah.
idea, okay?
Yeah.
False idea, very good. Or they are, okay, there's a snake, right? Okay.
Yeah,
Or
false
of
visions,
course,
yeah.
the best is the illusion of grandeur. I told you, schizo is a very, very good. Very, very good. Okay, excellent. In what? In the delusion of grandeur. You will believe, my dear. That's why I have a joke before in my student in psych, okay, in a BSN program, right? I have a joke. Be careful because you don't know your girlfriend or your boyfriend has a delusion or is schizo. Right? So because they will pretend, hi, hello, right? In here in Brigmore, hi, hello, I'm what? I'm for example, Chris. Okay, I don't have a student here, which is Chris, right? Okay, Chris or whatever, right? So I'm a doctor, lawyer. Even me, I'm telling you, I know that the patient is what? A psych. But of course, I believe on her. Okay, that's why I asked the manager, is that true that Mrs. Blah, something blah, blah, blah is a CPA lawyer? Come on. That's why they laugh. Okay, and then we laugh in the clinical. Okay? So, meaning to say, they are what? They are very, very good for what? Delusion of grandeur. Okay? But you will see right away if they have something. The way they talk to you and the way they think, okay? You will see right away if you are good in assessment. Okay? But again, it will take time sometimes, but sometimes, by experience. Okay? Bizarre behavior. Yeah, what is bizarre behavior?
Unusual behavior.
Okay, unusual behavior, like what's delusion, right?
Or laughing for no reason.
Oh yeah, they will laugh. Oh my God. If you are in the actual clinical, you will see everything. All the signs and symptoms in the whole world. Okay? I just use on that. That's why I just ignore. Okay,
So,
next.
Mary Jane,
Miss
can
Mary Jane.
Miss Mary Jane, can medication cause them to be doing this also?
Haldol.
Okay.
Haldol is the best. One of the best. Okay? Actually, the Toracin and Haldol. But the Clozapine, the Risperdal, the new one, it's not really. The Haldol is the best. Okay?
Okay.
Who's that? Okay, next. Negative. Negative symptoms. We have a singer here. Okay, negative symptoms. When you say negative, this one is positive. Why this one is positive? Because it's still, you will what? You will see them, in a what? It's still in a bright side. They are talking, right? But, of course, it's schizo. psychotic disorder. Why the following are negative? Because if they are flat affect, they are like that. Be careful if they are flat affect. I'm telling you, you have to be careful. Like what happened to us in one hospital. Somebody threw something. Okay, be careful. Actually, before in St. Mary, when I was new clinical instructor, somebody threw me like a plate, a plastic plate.
Ooh.
Oh, yeah. But I just, yeah. I'm not doing anything. I'm telling you, they are what? They are very, very dangerous. Yeah, I'm telling you. That's why my co-worker before, co-teacher is telling me, actually, you know what? I idolize you. How come that you say yes to the, psych clinical? Okay? So because the offer and at the same time, the load is full load in what? In the psych. They are paying good in what? In university. I'm telling you, one. I'm not trying to, but they are paying good just to go to the clinical of psych. One day clinical 12 hours for 7 to 8 weeks. They are paying 5,000 just to go to the clinical of psych. One day. But that is what? That is for almost 2 months, 1 day. How about if you have 3 days? If you have 4 days? Yeah, they will pay you that one. Okay? Because what? Nobody wants to go to the site. Okay? Next one. What is APEC? APEC. Anybody from you? Look up if you don't know. What is APEC?
It's a usually blunted, narrow range of expression or flat facial
Okay,
expression.
flat. No expression.
That
Okay?
never change.
Flat. Very good, Miss Laika. How about the allogia? Can you look up what is allogia? So this is negative. This is negative.
It's
Lack of
a
enjoyment.
process of poor thinking.
Okay, poor thinking. So that is negative. Okay? What is anergia?
Lack of energy.
Lack of energy. And what is anhedonia? Very
Lack
good.
of pleasure or joy.
What is that? Lack of joy. And
Okay.
abolition. What is abolition?
Lack of motivation and activity.
Okay, so this is a negative. Okay, because here, they are happy, they are talking, they are all over the place. Actually, I'm telling you, I love the psych patients. They are happy. Sometimes they will ask me, where is your student? Okay, yeah, they are there. Where are the girls? Okay, they are here. Okay, oh, you have also a male student. Yeah, only one or two. They are looking. Okay, and they are happy. Okay, next, proceed. What are the characteristics of psychotic disorder? As I told you, in general, I will not do word for word. They have a disorder thinking because of the dopamine. But I'm telling you, they are very, very intelligent. Okay, I encounter a lot of undiagnosed before. Very intelligent. They can what? Pass the NCLEX with no problem. Okay, but the attitude is too much. Okay, attitude. Okay, and then of course at the same time they are all over the place. All over. Impaired working memory. To make the story short, do not what? Do not memorize disordered thinking. Okay, and then of course the way they talk, the way they what, the way they, of course, the speech and of course the decorum are affected. Now, another one, all of the psych disorder, whether you like it or not, they have a suicidal ideation. Automatic. If your patient is taking any type of psych medication, by the way, we need a consent. We cannot give the psych medication without the consent. Consent from who? Either patient or a guardian or a POA. Okay? Because we need to explain the side effects. Sometimes they don't want to take the what? The Haldol or the what? The antipsychotic medication because of the side effects. And also, we have to check the sugar because psychiatric medication, it has a content of sugar. Okay, are we good? And at the same time, dysphoria. They are what? They are dissatisfaction in life. Okay, unsatisfied in life. They are looking for, something. They want to be a millionaire in just a blink of an eye. It's impossible. They want to be like that in just a blink of an eye. It's very impossible, my dear. Because me, I study a lot. Until now, I'm not a millionaire. Okay? But what? I gave all my time and energy. So this one, dysphoria, dissatisfaction in life. Okay, now, in delusion, here are a lot. Delusion of grandeur, can you write it down? Okay? And then also, delusion of persecution. What is delusion of persecution? Oh my God. The FBI are there, outside in my house. Why? They will what? They will what? What is the delusion of persecution? They are thinking that they are unsafe. Somebody will what?
Follow them.
Follow them and cut them, right? FBI. Okay, now being controlled. They don't want to be controlled. Okay? And then at the same time, what? Some of them, psych medication, they have a lot of cross. Bible. Okay? Very religious to the highest level.
Yes.
Okay,
Very
times 10, right? Times 10. Again, everybody, we believe in prayers and of course, different what? Different religion. We have to what? We have to respect. But this one is like an over times 10. Very religious. Magical thinking. Of course, the thinking is up and down, up and down, up and down. Okay? And then inability to maintain attention. That's why they cannot focus on work. Okay? They lose their job right away. Okay? Sometimes terminate. Okay? Because they cannot what? They cannot, inability to maintain attention, inability to make a relationship, so on and so forth. Again, I don't want to what? To make it very complicated to you. All you have to do, the thought process are distorted or disorder, speech, and the way they what? The way the decorum. That's it. Okay, let's go to the speech. Speech. Okay, let's do it. I already discussed the speech. What are the flight of idea? They are almost the same. Flight of idea from one idea to another. Actually, they are almost the same. Neologism, they are coining new word. They are making up. I don't know, what's going on with that words. Okay, ecolalia. They will repeat what you are talking. Ecolalia. Okay, this one.
Like echo.
Sometimes, echo. Sometimes you will laugh. You don't want to laugh because you know what? That is what? Psych patient. But sometimes you cannot what? You cannot control yourself to what? To laugh. Okay, clang association. The clang association is what? Like loss of association. Okay, so from one topic to another, there's no association. Word salad, almost the same. Different word, like a fruit salad, our favorite fruit salad, right? Salad, meaning to say, different what? Different ingredients or macaroni salad. Okay, and then what is circumstantiality? Anybody from you? And tangentiality. Can you look up what is that? Student participation.
Including multiple and unneeded details during a conversation, such as describing in great detail the weather and clothes she is wearing when asked what her plans are for the day.
That is the
Tangentiality.
Yeah, it's the same. It's almost the same about what? In the speech, right? There is no direction. How about the tangentiality?
It starts talking about trivial information rather than focusing on the main.
Unrelated. Yeah, it's the same. It's a speech, you know? So on and so on. And you will see right away that this is, oh my God, this is something. Okay, now, alteration in perception, hallucination. Hallucination can be a sensory perception, right? That do not have any external stimulus. Auditory, right? You are hearing something that nobody is what? Only you, right? Visual, you see something. Olfactory, you smell something. What is the tactile and gustatory? What is gustatory?
Taste and sensation.
Okay, taste and sensation and tactile. What is tactile or tactile?
Touch.
What's that?
Tongue, something relating to tongue.
Mhm.
Which one?
Tactile.
Tactile, related to tongue.
Okay. So we're good? Yeah, everything. So there's something wrong about the senses. Now, oh yeah, the sense of what?
Touch.
Okay, very good. Sense of touch. It's all about what? Senses. Now, the personal boundary difficulties, be careful. All of them, you know, you have to make a boundary. Okay, boundary. Because or else, I'm telling you, they will be very attached to you. They are very what? And don't tell your secret. Even you don't have a secret. Because they are what? Too vulgar. Okay? When you want to what? Separate them, they will what? Very vulgar and very invasive. Okay? So be careful regarding the boundary. Okay? Boundary. Or else, I don't know. You know? Next one. Alteration in behavior. As I told you, when they what? They have a problem in anger. So they need to undergo some of them in what? Anger management. Anger management. And then also the waxy flexibility, I told you like a catatonic, they have to the highest level. Okay? And then the catatonic sometimes or sometimes they what? They will stay what? In one position for a long hours. That's it. That is schizo. Okay? Patient-centered care. So again, you don't need to memorize this one. Number one, what is the medication? Haldol. Write it down. Type A, typical Haldol or SIN. Toracin. Sin. Toracin. Thorazine. Okay? So, and then of course, Haldol. Haldol is the best one and the popular one. Typical. Okay, atypical. I told you already. Risperdal, Seroquel, Zyprexa, Clozapine. Clozapine, you need to monitor the WBC because it can lead to a granulocytosis. Okay, and then Zyprexa, of course, you need to what? You need to monitor the weight because it can lead to weight gain. Okay? And then, before I think, they include me. I'm not into home health, but they include me about the, for example, Zyprexa, the Medrep, all the Medrep, they are offering like a good restaurant. You have to hear what is Zyprexa, what is Seroquel, yeah. So somebody include me there, about and then according to that particular seminar, Zyprexa can lead to weight gain. Seroquel, you need to check for eye exam. And then of course, the Clozapine WBC. Because it can lead to what? A granulocytosis. That's number one. You don't need to memorize this one. Second, what type of diet? If you don't know the diet, of course, the well-balanced diet. Letter C, what type of group therapy? Milieu therapy, therapeutic communication, and then safety is our priority. That's it. Do not memorize. Okay? So clear. So again, these are repetition again, my dear. These are the first generation of medication. Haldol is the best. and all the sin in the whole world, or INE. Clozapine, chlorpromazepine, fluphenazine, thioridazine, and all the sin, or INE, in the whole world, aside from Haldol or haloperidol. Are you following me? Now, all the what? Psych medication, 99%, they have a sugar content. But make sure we have to check the sugar and encourage fluid intake. And of course, we have to what? The position, because it can lead to orthostatic hypotension. Okay, are we good? Aside from that, write it down. Write it down. We have to administer Congentin, because what is our goal? Why we are giving Haldol? To decrease what? To decrease what?
Dopamine.
Dopamine. Very good. Okay, Miss Mugo. So, again, with the dopamine, so what will happen if you have a decreased dopamine? What to look for? Parkinson disease.
Extrapyramidal.
Very good. To prevent EPS, or extrapyramidal signs and symptoms. What is that? Extra. Like extra what? Movement. Like what? Like Parkinson, like tremors, lip smacking. Okay? And then, like what? Movement. To prevent that, Congentin. Okay? Write it down. Congentin. Second generation, Risperdal. Right? Olanzapine, Clozapine, and then Seroquel. These are the second. These are the second what? Second generation. Again, first generation, Haldol is the common and the sin. Treat the positive signs and symptoms. And of course, second, same thing. Treat the positive signs and symptoms. Okay, next. There is a third generation, but not really a popular. So, apiprazole. So, write it down. So, treat positive and negative symptoms. And decrease of what? Of EPS. Are you following me? Again, can you tell me what are the true groups of what? Two groups of medication. Under what? Under psychotic medication. Micaela? Miss Micaela?
The two groups?
Yeah.
Well, the first one, what do you mean by two groups? The first
The
generation?
first generation, yeah.
Oh, like Haldol and Laxoprin and Chlormazepine. You have to administer Congentin for the low levels of dopamine to prevent EPS. And
Especially the clozapine, because it can lead to agranulocytosis, which is destruction of WBC.
BC.
Okay, that's it. Very important, very favorite. Okay, what else? I think that's it, right, Mika? Miss Mika?
Yeah.
Okay, thank you. Now, of course, part of the signs and symptoms is depression. So we have to give, here we go again.
Miss Mary,
Yeah.
I had a question. What's the difference between the first generation and the second generation? Like what makes it
The
different?
first generation, this is like the best medication.
Okay.
Because at the same time, the side effects is less than the second. Unlike the second, when we get a clozapine, agranulocytosis. So what is agranulocytosis? Destruction of WBC. So, or we can say first choice. And then
Less side effects, is that what it is?
Yeah, aside from that, less side effects, and at the same time, first choice, meaning to say popular or most effective.
More effective.
Very good. There you go, Mr. Rohel. Congratulations. Okay? Thank you. All right. Next one. Medication again. Antidepressant again. From yesterday again. Okay? Solo, Paxil, the SSRI. Right? All of them. There is no magical, miraculous side effects for all of them. Okay, what will you do for the antidepressant, first generation, right? So it can take what? 2 to 4 weeks. All the psych medication, antidepressant, except for anti-anxiety. Okay? Antipsychotic, it can what? It can take 2 to 4 weeks or several weeks. Okay? Okay, solo, Paxil. Right? Solo, Paxil, Panama, country of Panama, Marnate, Nardil, Marplan. And of course, antidepressant too is the Lin. Okay? Next, another one, medication. So we have to deal what? The mood. Still, they need to what? Take lithium. If not lithium, the other one, like the anti-seizure medication. Lamictal, Tegretol, right? And of course, some benzodiazepine because they are what? They are something. Okay? So here, I don't know what to do. So here are the list of everything. And I don't know. I think Latuda. You know, we went to a seminar in Latuda. Okay? They just invite me. You know, about the Latuda. They just include me in the seminar. Because according to them, they are what? They will, if you will attend to the seminar and you are a nurse, they will what? Different restaurant. Okay? So, Latuda. So, sometimes what? A wildfire. Okay? So, what else? Sometimes in Aruns. Okay?
Oh,
Different.
title.
Oh, yeah. Nice. Latuda. I think I attended Latuda. Okay? For what? For to treat schizophrenia. Pretty much it's in here. And I don't know what to do. Okay? So, you have to what? This one is the medication. Okay, are we good? Yeah, it's what? It's a repetition. Because I told you already, I type in what? I type in your what? In your whiteboard. All right? So we're done in what? In schizo. So pretty much we are done in the 3 main things. Anxiety. Okay, what is anxiety? So under anxiety is the PTSD, anxiety, phobia, what? What else? OC.
OCD.
What else? Panic attack. Okay? And then after that, we're done with bipolar. 2 phases. The what? The depression and the manic. And then schizo. So we're done with the main topic. Now, let's go to the personality disorder. Before I will give you a break, okay? I want to finish everything. And then after a break, review. I will not hold you too long today. Okay? So, because it's a lot to read. Next, personality disorder. So, personality disorder is a client demonstrate a pathological personality disorder. Okay? And then also the client exhibit impairment in self-identity, like the dissociative, right? That is considered a personality disorder. But of course, that is dysfunctional. Okay, dysfunctional. So, and of course, part of the what? Part of the disorder, they are depressed, anxious, they have like an eating disorder or substance use disorder. Now, personality disorder, they are using a lot of defense mechanism. Repression, suppression, you know this one, right? I remember the boy, but I don't remember the feeling anymore. Repression and suppression. You are trying to, I don't know who's that. Like I love the movie, Filipino movie of Amnesia Girl, right? Because of the bad, what? The bad thing, the bad experience, you know, the groom is what? The groom walked out to the wedding. So pretty much it gives to the what? To the bride a big, big trauma. Okay, when she saw the groom after a while or after a year. Okay, she just said, who are you? I don't know you. I undergo amnesia. Okay, so that is what I consider this one like a repression and suppression. She's just acting actually. But that is the best example. Okay, regression, you know that, right? Going back to the childhood, okay, activities, undoing and splitting personality. But splitting personality is very popular in personality disorder. What is split personality? Anybody from the class. Split meaning to say, what's going on?
Yeah.
They can be very friendly, but I don't know where they can be
guess.
so angry at you.
Display
So they have-
negative or positive.
Positive.
Yeah.
Positive split. Okay? Like a split. Okay?
Split
I
person.
need to split you in the two groups, A and B. So splitting. Split into a positive or a negative. Okay? So client, the risk factor who have a personality disorder often have a comorbidity of what? Substance abuse. Substance abuse. I told you because of the what? Intoxication of the drugs or the substance abuse. That's why this is one of the risk factor. Okay? And then also history of non-violent and violent crime, including sex offenses. And psychosocial influence, childhood abuse, trauma, developmental factor with a direct link to parenting. What are the signs and symptoms of personality disorder? A positive and a negative. A positive and a negative. Again, if you don't know that one, they have what? Interpersonal conflict. They have a problem with boundary. They have a problem with personality. Okay? So everything, distorted thinking, everything. Then personality disorder, here we go again, is paranoid. You know the paranoid, right? Very suspicious. Schizo, like schizophrenia, right? And then histrionic, like a what? Attention seeking. Oh, I love the narcissistic. Do you know who are the narcissistic? Who's that?
Self-centered.
Okay, self-centered. Or go to your Facebook. The selfie queen and king. Okay, just kidding. Okay, right?
Aray.
Narcissistic. Okay.
Oops. Ouch.
All right. It's only a joke, okay? Narcissistic. And then the antisocial is a rule breaker. So that's why sometimes, you know, even in the typical what? Even in the typical acute, you know, acute hospital, they have a police. They have a case. Not everybody, right? They need to go back to the jail. Some of them. Okay? Because they have a lot of what? Rule breaker activities or abusive, aggressive one. Antisocial. They are the candidate for what? For the anger management. Borderline, right? Very impulsive, self-mutilative, or manipulative. Actually, for me, all the psych is very manipulative. The psych patient. Okay, are we good? Yes or no? So this is like a what? This is like a repetition. I don't want you to be what? I don't want you to be confused. Okay? So the histrionic, they are the self-centered. They are very drama. They are the drama queen. Okay, I encounter a lot of this one. They are always crying. They are making, you know, they are making something, a big what? A commotion or whatever. So a drama queen, histrionic. Narcissistic, who is that? Is
Self-centered.
what? The self-centered, the selfie queen.
Mostly men.
Okay, yeah. The self-importance. Sometimes I know somebody, okay, that you know that you need to what? You need to, when he arrived, you need to announce themselves, right? They need to have like an invitation, something like, right?
Oh,
Something
gotcha.
like that. Oh my God. Whoa. Who are you? Oh, so sometimes I attended a one party, you know, one party, and then the party is all about the husband and wife birthday. So what happened is when he arrived, so he looks like that he is the birthday celebrant. Okay? So sabi ko, oh my God, okay, right? Okay, but the husband and wife is just like sitting in one corner. Ah, so not in my birthday. In my birthday last year, before the COVID-19, I'm the star of the show because that is my birthday. Okay? Because I'm the one who
With
paid
the-
for it.
With
Right?
the dress, right? With the dress.
I'm the one who
The
paid
gown,
for
I
it.
mean, the gown. The
Oh,
big
yeah. Okay? So this one is like, oh my God, you know, the husband and wife are the birthday celebrant. So we need to give what? We need to give the floor. Like the student. Sometimes I'll give you the floor. Right? You are the star of the show. Okay? You are the star. That's why sometimes I want you to talk. You are the star of the show, right? Okay, very good. Now, anti-social. What is the anti-social? Rule breaker.
Rubric.
Too much, my dear. They are the what? The criminal. Okay, when you open what? When you open their chart, oh my God. So they have a what? They have a robbery, murder. Okay? I have a friend before, but he's very nice. Knocking on my door, Mary, Mary. And then sometimes, okay, can I open this, you know, the patient? Oh my God, murder, robber. Huh? Robbery. So I asked the what? I asked the manager from the social worker. Oh, what's going on? Why the, you know, there's a lot of murder and robbery here. NGOI, non-guilty because of insanity. When you go inside to the psych unit, be careful because half of them are the NGOI. That's fine if they have what? Atypical what? Atypical bipolar, atypical schizo, but 50% NGOI. Non-guilty because of insanity. Not only in the what? In the chronic or in the acute setting. There's a lot right now in the long-term care. Okay, long-term care. Are you following me? Yes or no? Aside from that, they have an avoidant. What is avoidant? Avoidant, they avoid all situations that required interpersonal contact despite wanting close relationship. Okay, they avoid, very avoidant because of the what? Fear of rejection. Avoid. Okay, and then dependent. So usually, you know, the personality disorder, they are dependent in the relationship. That's why you have to be careful because if you want to go out on the relationship, even friendship, oh my God, they are very what? Vulgar. Okay, and very invasive. Okay, very invasive. OC, it's a part of the disease, right? As what did you notice with the psych? Did you notice that anxiety, depression is what? All of them is a part of what? Of the disorder. Did you notice? Yes or no?
Yes.
Okay, it's a part of the disease. Depression, anxiety is a part of all the psych what? Disorder. Okay, paranoid. Paranoid. Again, we are in the personality disorder. What are the personality? Paranoid. Okay, antisocial. Right? What else? Aside from antisocial, histrionic. Aside from histrionic, narcissistic. Okay, are you following me? That is considered a what? A personality disorder. Okay, are we good? Paranoid, they are too much. They are what? They don't have a trust. So they have a what? Always, all the time, right? Suspiciousness toward other. That what? That others will harm them. What will you do, Miss Mubo, if your patient is paranoid and you have to give a medication? What will you do?
Maybe I will try and be friendly with them so that they can have that trust in me.
Aside from that, paranoid, very paranoid.
Maybe explain what you're giving to them.
Okay, explain what you're giving to them, and at the same time, you have to open the medication kit in front of them. Because they will think that what? You put something on the what? Drink or whatever. So be careful. Even me, I'm not giving like an open. Sometimes, you know, for example, I want to give something, it should be always a seal. Okay, and then if you want to what? If you want, for example, you want to have a birthday party, right? Or a what? Or you want to you want to prepare a food. You want to invite somebody, right? This is only my personal, you know, my personal thing, right? It's better to order from the restaurant. Okay? Because sometimes I love to cook, right? I love to cook and then I want to what? To share my spaghetti recipe and white sauce in my student in my review. Okay? But no, somebody scolded me about that. Okay? You don't need to do that. You have to order in the restaurant. Something happened. You know, at least you can show what? Oh, this is from what? From this restaurant. Okay? If you don't know the audience. So, be careful. That's another one. So, for the paranoid, you have to open the what? The medication, the drink, it should be what? It should be the sealed one. Food, sealed one. Because even if it is true or not, if they create a noise, oh, Mr. James put something, even if it is what? Even if it is true or not, it's a what? It's considered a what? Right? They will still investigate. Okay? They will still investigate. So, you better what? You better to be careful. Okay? So, clear for everybody. I will not do word for the other, you know, it's a repetition. Okay? So anyway, any question for histrionic? Again, this is like, you know, like an additional histrionic, meaning to say a drama queen, a drama king, right? Narcissistic, a self-centered, right? Right? A selfie queen, right? A selfie queen. Antisocial, a rule breaker.
Mhm.
Okay, that will be paranoid. That will be what? That will be another one under personality. Of course, there's another one. Avoidant. They avoid everything. OC is a part of what? Of personality. Okay, again, what will be the intervention? Here we go again. Medication, psych medication. If they are anxious, anti-anxiety. If they are depressed, antidepressant. And then milieu therapy, safety is our priority. That's it. End of the end of the story. Okay? So I'll give you a break. 20 minutes, 6:30. Okay? So what is our activity after the break? So we will go over. Okay? It's easy. If you listen to me today and the other day, it's easy. Okay, let's have a break. Okay, so thank you.
I always feel like somebody's watching me.
Go Kuya James. Practice.
Good morning, James.
Yeah.
Tita Girlie's boxes. Jeez.
What happened, Mr. James?
Tita Girlie's boxes. This and then at the other house, maybe multiply by 4. Then times 2.
You gotta move stuff today?
No, I already moved it. She just gotta arrange it in the basement, you know?
Mm.
But it's like a truck full of clothes. Shoes.
Then let her arrange it.
But yeah. I'm gonna tell her that, right?
Yeah, if you want to die, yeah, you should tell her that.
Yeah.
It's all right. You should be fine.
Hey, Roel.
Yes, yeah.
Miss Mary Jane was looking for you earlier.
Oh, I was trying to get into the Zoom meeting. I guess I put the wrong ID number, so I have to
Yeah.
ask B for the new. And miles for the new one.
Yeah, just tell her. So this way, I don't know if she marked you absent. No, I think she said if it's an hour. I take that back. If it's in the
Yeah,
morning.
I know it's like an hour or 30 minutes. It's a 30 minutes.
Yeah.
Should be good.
So when are we doing the picnic thing?
I don't know. It's up to you guys.
Just have it at John's house. Be easy.
Oh yeah, John.
John. You're on mute.
You're on mute, John.
What about my house?
Picnic.
We're gonna have barbecue at your house.
Barbecue at your house.
Yeah, if you guys can find parking here, that's fine. I don't mind it.
Let's all do.
We'll do Korean barbecue.
Korean
With
barbecue.
soju, right?
Yeah, we can do Korean barbecue.
I can bring ribs, you know.
Huh?
Oh, you haven't. You got to try my ribs, man.
Well, yeah, I haven't.
It's a fall off the bone, 4 hour to cook.
Yeah.
And then the sauce is only like maybe 10 minutes and then broil for 5 minutes.
Oh, okay.
Nice.
Definitely got to try it then.
Yeah. Then we'll do shots of soju, you know. Then I'll bring my karaoke and then it's a party, right?
Yeah, soju can sneak up on you.
Oh yeah.
I like Korean barbecue.
You drink a bottle of that and you don't think you're drunk, and then it hits you like a car crash.
Really?
Yeah. But it's gonna take. It's gonna be a lot. We need a lot more soju. Because I don't remember when we were drinking it at my mom's house. Well, I only took 2 shots.
I don't recall doing any shots.
Yeah, right.
I mean, not just 2. I think it was more than 2.
You were mixing the clear and the brown, weren't you?
Yeah.
I did a soju bomb. I was like, put it in beer.
I know, man. Summer's almost over.
Yeah.
You gotta enjoy it, man.
Wasn't much to enjoy. I was supposed to go to a concert this summer, but it got canceled twice already.
Oh, really?
Yeah. So hopefully, I don't know. I might get a refund for the tickets. I'm not sure.
Ticket? What concert was it for?
It was a hip hop concert. Yeah. A lot of stuff. No, I'll be back with you.
Okay, so we're good. Okay, that's good, right? Did you eat? How about you, Miss Charmaine? Are you okay? Miss Charmaine? Charmaine, you're okay? Mm.
I'm just taking it easy.
Mm. Are you still working? Do not work.
No.
Rest.
Yeah, they don't want me working.
No. Oh, just take a rest.
Yeah,
Just
just
take a
Yeah,
rest.
it was hard to convince my doctor to get me to stay in class.
Oh
But
yeah, I need that one.
I
Because-
sent it. I sent it
Oh, you sent it to me?
on
Yeah.
Schoology.
Okay, thank you. Yeah, just to make sure because we need that documentation. Okay,
Is-
thank
is
you, Miss
cl-
Charmaine.
Is clinicals done through online?
Yes.
Okay.
Mm-mm.
Because he'll only let me do online.
Yeah, online. Okay. So I told you, it's a liability. Okay, because if you know, like what happened to you, it's my liability. Because as a nurse, like for example, you already saw the signs and symptoms, right? And then what did you do? So you are in trouble. So just like me, even if it is true or not, if somebody is telling me that I have a shortness of breath, I need to call 911. Okay? Even if it is true or what, or not. Like what happened to what? Right? What's that? The controversial, what's that? The controversial one? The police versus who's that?
Oh,
Are you George Floyd?
George Floyd.
Right? I in the story, what George is saying that I'm having a shortness of breath, right? But again, even if it is true or not, we have to do something. You already what? You already what? Observe the signs and symptoms, even if it is true or not. I'm telling you. That's why if somebody is telling me before, when I was a CNA instructor long time ago, somebody is what? I'm only a substitute teacher. Somebody's telling me, I'm shortness of breath. Okay, let's call 911. We call 911. Okay, so that's it. Okay, so that is our what? Part. Okay, so anyway, moving forward, let's start again. Are you ready? Everybody are here?
Yep.
Yes.
Okay, so Charmaine, who is the user? User, Winnie.
Oh man. Somebody go get Winnie. She's in the kitchen.
Oh my washing the dishes now.
Washing dishes.
Washing dishes.
So now you're making fun of Okay. And then Miss Micaela. Miss Micaela.
She just texted her computer keeps freezing.
Okay.
Yeah, I think Evelyn said the same thing.
Okay, and then Teresa. Miss Teresa.
I'm here.
Okay. And then okay, Rohel.
I'm here.
Okay. Laika, Miss Laika.
I'm here.
Okay, Joyce, Miss Joyce.
I'm here.
Okay, Miss Patel.
I'm here.
Okay, Miss Yadira, washing dishes.
No, I'm in front of my
Okay.
computer.
Okay, Mr. J. Mr. J.
Yeah, I'm still here.
Okay, and then Mr. B. Okay. Okay, so I think we're good to go. Okay, so write it down. This is your exam number 1. Okay, so let's go to the PowerPoint number 1. Okay, so the PowerPoint number 1, my question sometimes 1 to 3 points. Can you please explain what is the mental status examination? I will ask that is for sure. Okay, so mental status examination. So you will type, it consists of the following: LOC, Physical appearance, behavior, and cognition, cognition abilities. Okay? So that's for sure. And then the next one, that my favorite is the DSM 1 to 4 or 5. So DSM 1 or Axis 1 is the main diagnosis. 2, what is 2? Personality disorder, like histrionic, antisocial, right? Okay, paranoid, okay? And then 3, if they have a what? They have, what's going on? They have a what? They have a medical diagnosis. They are what? They are in the psych facility because they are depressed, they have a cancer. And then 4, social. 5 is score or total. Okay, so that's for sure. Maybe a what? Maybe I will, okay, 5 to 9. Tell me what is DSM 1 to 4. Or maybe one what? One question only, DSM number 3. Okay, medical diagnosis site. Okay, now explain what is miliotherapy. It's all about environment. Okay, are you following me? Now, another favorite that I will ask you is about the involuntary admission and the voluntary admission. Okay? So I will ask you, what is the difference between voluntary admission and involuntary admission? Okay? And then, of course, my other favorite too is the therapeutic and the non-therapeutic communication. Give me an example of therapeutic. Silence. Tell me more. It seems, it sounds, verbalization of feelings. Right? Can I sit with you, Mr. Smith? Offering yourself. Can I walk with you, Mr. Smith? You look so nice today. I noticed that you comb your hair. Giving recognition. How about the what? The non-therapeutic communication. What is the non-therapeutic communication? So, do not give advice. Do not give false reassurance. Okay? Do not challenge their illogical thinking. Don't ask why. Okay, are we good? It's only a 50 items. Okay, next one. Next one, another question. I will just pinpoint here like a defense mechanism. Okay? So, maybe, what is sublimation? Or what is suppression or repression? I remember the boy, but I don't remember the feelings anymore. Right? Or I will ask you, what is regression? A sudden use of childlike or primitive behavior that could not correlate with a person's current developmental level. Or displacement. Shifting feelings related to an object, person, or situation. Less threatening. If you are very angry to your boss, you cannot scream to your boss. Instead, maybe you can scream to what? To the secretary of your boss. Right? Or to your what? To your younger sister or brother. Or what is undoing? Or reaction formation. Maybe 2 points. Or rationalization. I failed the NCLEX because. And the dissociation. This is a multiple personality. Denial. It's not true. It's not true. It's not true. Or compensation. Right? I'm not good in math, but I'm good in science. Okay? So that's it. I will just ask 1 to 2 defense mechanism. Now, my favorite at all times is anxiety. Right? Anxiety, I will ask maybe what is agoraphobia, what is panic attack, what is claustrophobia, what is your intervention to anxiety? What is the medication for anxiety? Can you tell me what is the medication, Evelyn? Okay, anxiety.
Anxiety, anti-anxiety.
Okay, anxiety is increase of GABA. You remember the first day, right? In the first column. Increase of GABA, and GABA is a neurotransmitter. Okay? So now, what will be the medication? The benzodiazepine or the PAM?
And the ZAM. And the sodium medication.
There you go. Congratulations. Who's that?
For the Solam?
Yeah, Sulam.
That
And
was
Pam Pam. Okay, congratulations. Right? And then, of course, non-benzodiazepine is what? What is the non-benzo? Okay. Spar-Ambien. There you go. That's it. And what is the antidote of what? That's my favorite.
Flumazenil.
Oh, I'm not asking about benzodiazepine. I'm asking the digoxin. Ah, okay. All right. Next one. Next. My question, General. Give me a type of therapy. Okay, so you will give me a type of psychoanalysis therapy, psychotherapy, and behavioral therapy. Okay, let's do it again. What are the psychoanalysis? Right? Psychoanalysis, it's all about what? Focus for the therapy. So the psychology will interview who? The patient, right? To assess their unconscious thought and feeling, right? Or they have a therapeutic tool. They can use a what? Dream analysis, you know, they can use a hypnotherapy, right? Different tools. Psychoanalysis. Okay? Now, the psychotherapy is all about the cognitive triangle. Thought, feelings, and behavior. Okay? Psychotherapy and psychoanalysis. Now, what are the types? Letter B, behavioral therapy. It can be a modeling, right? It can be an operant conditioning. So client receive a positive reward for a positive behavior. Or it can be a systematic, this is my favorite, desensitization, right? Why? This is a gradual exposure. You have a claustrophobia, you have a what? You have an agoraphobia, you have a social phobia, so you have to be gradually exposed on what? On your phobia.
Yeah.
Like claustro, like elevator. All you have to do, you don't need to ride to the elevator. Instead, you can what? You can what?
Off the
You can
stairs.
hear, yeah. Not only that, but you need to hear the up and down of what? Of the elevator, the sound. Okay? So clear for everybody. Behavioral therapy. What are the example of family therapy? Right? Family therapy, working pace, they need to be together, right? So on and so forth. So that will be what? A family therapy. Okay, that's it. I don't want to make it what? A long story. Okay, and then at the same time, whatever I told you, that's it. That will be in the test. Okay, so what will be the behavioral technique? Give me an example, right? Meditation, guided image, music therapy, breathing exercise, relaxation. Give me an example. That's it. So that will be what? That will be another example. How to reduce stress? Give me 1 to 2. 1 to 2, how to reduce stress. Okay, and then brain stimulation therapy. Okay, what will be the 3 types of brain stimulation therapy? ECT, number 1, if the antidepressant is not working anymore. Okay, number 2, transcranial magnetic stimulation. So that's the 3. And then the number 3 is what? The vagus nerve stimulation. So you need to study the 3. You need to study the 3. Okay? And then on your slide number 3, this is what? This is the anxiety, right? So study this one at the same time, study the 3 column. You remember the 3 column?
Yes.
Right? So study that one. That will be the coverage of your exam because it's only 50. Anxiety, what will be my question? What is the neurotransmitter? If you are anxious, which is up, GABA. Okay? And then at the same time, what is PTSD?
Post-traumatic
disorder. Okay? What is separation anxiety? Right? So what is agoraphobia? what is claustrophobia, right? And what is social phobia. Okay? What's that?
Speaking.
Okay,
Speaking
that's
in
it.
front of the public. Yeah.
Okay, there you go. And then another one, what is dissociative disorder? But again, only 1 to 2 questions, direct to the point. Okay? And then after anxiety, antidepressant, depression, right? Depression, bipolar depression, and bipolar manic. After the 2, schizophrenia. Okay, you can read the PowerPoint here, but at the same time, you know, I want you to read, hold on, the what? I'm looking for the whiteboard. Okay, so the 3 column that we go over, hold on. 3 column. Why?
Safety is our priority.
Yeah, that's it. The 3 column. It's only 50. 50 items. Okay? Like a 50 items. And then we go over with that. Anxiety, bipolar manic, and bipolar what? Bipolar depression. Okay? And then how long? If the patient is taking antidepressant or antipsychotic medication, how long will take effect? It will take several weeks or 2 to 4 weeks. Very good. That's it. Direct to the point. Okay, the technique, go over with 1, 2, 3, and 4 slide. Memorize. That is for you too. Because again, ATI. You have an ATI. I don't want you to fail the ATI. And then what? You will get MB with your classmate, which is what? They are doing maternity. Okay? Are you following me?
Yes.
I want you to pass. But again, do the word for word 1, 2, 3, and 4.
Slides.
Memorize. And do not depend to anybody because at the end of the day, you will be what? You will be independent on your own. Okay? You will be independent on your own. Like, that's why even in my other class in AmeriCare, I'm what? I'm scolding them. You know, it's okay to be friends to everybody, but not really too much that you depend everything to your classmate. Okay? So I want you to become independent and of course work hard because I'm very fair person. Okay? Because sometimes even, you know, I will not say, you know, my technique, you know, I will pass a student who are always here on time, right? But for example, the grade is what? What is the passing rate? For example, the passing rate in one school is 76. My student have what? 75 point what? 75.99.
Right.
I will pass that one because I will deliberate. Oh, this one is always on time, always what? Listening to me. Okay? Always what? Always passing what? The requirements. Okay, but even, you know, that's why I told the other group that even you are what? You are passing the ATI. So attendance is a must because you are undergraduate. If this is a master's degree, that's fine. There's no attendance. Okay, so are we good? And you will say
Yes.
thank you to me. Ah, okay. You will say thank you to me because I'm trying you to what? To become independent. And congratulations because you are here inside, right? You are not what? You will not get MB to your classmate. Okay? Because even me, I'll get MB with, oh my God, they are doing the maternity and about me. Okay? But again, to prevent any what? Anything so that you will be on the next subject, which is maternity. Again, maternity. After maternity, what is the next? Pediatrics. After pediatrics, I think you will take pharmacology, ATI, right?
Yep.
And then exit. And then that's it. Congratulations. Graduation, diploma. Right? And then work. Okay, so even the LPN, my dear, can what? Can make 100,000 in a year. Okay, the what? The mind is saying yes, but
That's
the
the
body is saying
Say no.
no. Okay, the body is saying no.
No.
Okay, but I'm telling you, LPN can make. You can be a home health nurse, so maybe you can what? You have a 3 days, 12 hours in one what? One full-time job, and then on the side you do like that. Okay, because the full-time job, this is what, of course, paying bills, and then this one, the other one,